If you are constantly reaching for antacids, waking up with a bitter taste in your mouth, or feeling that painful burning sensation in your chest after meals, you know how exhausting acid reflux can be. In this video, you will find 15 natural, science-backed strategies to help fix heartburn, ranked from the most helpful adjuncts to the most powerful lifestyle changes. Before we start, let's cover the safety red flags. If you experience chest pain, difficulty breathing, vomiting blood, black or bloody stools, or sudden unexplained weight loss, do not rely on home remedies. These are signs of serious conditions requiring urgent medical attention. This video is for education only and is not medical advice. Always talk to your doctor about your own situation. If you are ready to cool down the fire and take control of your digestion, please like this video and subscribe to Anai for more wellness guides. Let's begin our countdown with the top 15 proven ways to stop acid reflux. Starting at number 15 is the use of multi-herb formulations, specifically STW5, also known as Iberogast. This is a liquid blend of herbs like bitter candy tuft, chamomile, peppermint, and licorice. Research indicates that it may help reduce reflux events and esophageal hypersensitivity in some people. In a study of patients with high acid exposure, those taking this formulation saw their number of acidic reflux episodes drop from a median of 52 down to 33. While it's generally well tolerated, there have been rare reports regarding liver safety with herbal mixtures, so use it cautiously and discontinue if you notice any adverse effects. Number 14 is managing your personal trigger foods. While the evidence is mixed on whether everyone needs to avoid the same things, we know that alcohol, chocolate, and high-fat meals can relax the lower esophageal sphincter, the valve that keeps acid down. Reducing these triggers can lower symptom frequency by 20 to 50% in sensitive individuals. The best approach is an elimination and re-challenge process. Common culprits to test include fried foods, fatty meats, caffeine, spicy foods, carbonated beverages, and mint. Coming in at number 13 is a simple life hack: chewing sugar-free gum after meals. This works by stimulating saliva production, which contains bicarbonate that neutralizes acid and helps wash it back down into the stomach. A controlled trial showed that chewing gum for 30 minutes after a meal reduced the time the esophagus was exposed to acid by about 37%. Just be sure to choose sugar-free gum to protect your teeth, and avoid mint flavors if mint is a trigger for you. Number 12 is melatonin supplementation at bedtime. Beyond sleep, melatonin plays a role in gut health. It has been shown to protect the esophageal lining and, interestingly, may increase the pressure of the lower esophageal sphincter. Clinical trials suggest that taking 3 to 6 milligrams at bedtime can improve symptom scores significantly and increase valve pressure by up to 50%. As with any supplement, check with your doctor, especially if you are on other medications or if you have autoimmune conditions. Number 11 is Deglycyrrhizinated Licorice, or DGL. Unlike standard licorice, which can raise blood pressure, DGL has the risky compound removed but keeps the flavonoids that support mucosal healing. A recent 2025 trial using a standardized DGL extract found that participants had significantly better symptom resolution for heartburn and regurgitation over 28 days compared to a placebo. It is a soothing option that generally improves symptoms within 2 weeks. Moving into top 10, we have alginate-based antacid formulations. These are over-the-counter products derived from brown seaweed, often found in products like Gaviscon Advance. Unlike regular antacids that just neutralize acid, alginates form a foam raft that floats on top of your stomach contents, physically blocking acid from rising. Studies show that this can reduce reflux episodes and improve symptoms by an additional 20 to 30% compared to standard treatment, making them a strong choice for post-meal or nightlife relief. Number 9 is specifically for smokers. Quit smoking. Nicotine relaxes the valve between the stomach and the esophagus and impairs your saliva's ability to clear acid. Large studies show that for daily smokers with severe reflux, quitting can double the likelihood of symptom improvement. While it is a difficult habit to break, the benefits for your digestion and overall health are profound. Number 8 involves diaphragmatic or deep abdominal breathing. The diaphragm muscle helps support the anti-reflux barrier. A randomized trial found that patients who perform deep breathing exercises, 30 breaths, 3 times a day, saw significant improvements in symptom frequency and quality of life compared to those who just took medication. Strengthening this muscle can effectively tighten the seal, preventing acid from escaping. Number 7 is adopting a Mediterranean or plant-forward diet. This isn't just about avoiding triggers, but about the overall quality of what you eat. Studies indicate that moving away from processed Western foods towards a diet rich in vegetables, fruits, whole grains, and healthy fats can cut GERD risk by nearly 50%. This dietary pattern is also associated with better sleep and overall lower inflammation. Number 6 is increasing your dietary fiber, specifically through psyllium supplementation. A study where patients added about 12.5 grams of soluble fiber per day found that it increased the resting pressure of the lower esophageal sphincter. This led to fewer reflux episodes and a reduction in heartburn frequency. Start slowly with fiber to avoid bloating, and always drink plenty of water when taking psyllium. We have reached the top 5 most impactful strategies. Number 5 is avoiding late night meals. Eating close to bedtime is a major cause of nighttime suffering. Controlled data suggests that eating within 2 to 3 hours of sleep increases nocturnal reflux episodes by 50 to 70%. Aim to finish your last meal at 3 to 4 hours before you lay down to give your stomach ample time to empty. Number 4 is sleeping on your left side. This is a matter of gravity and anatomy. When you sleep on your left side, the stomach is positioned below the esophagus, making it physically harder for acid to leak up. Studies using sleep monitors confirm that this position can reduce acid exposure time by 40 to 70% compared to sleeping on your back or right side. Number 3 is elevating the head of your bed. This means that raising the entire frame or using a large foam wedge to lift your torso 15 to 20 centimeters, or maybe even more. Propping yourself up with just pillows does not work. It can actually worsen pressure of your stomach. Proper elevation uses gravity to clear acid quickly. It has been shown to roughly halve the number of prolonged reflux episodes at night. Number 2 is reducing carbohydrates, particularly refined ones. Very low carbohydrate diets have shown impressive results, sometimes reducing acid exposure by 40 to 50% within just 1 week. High carbohydrate loads can cause gas and abdominal pressure that forces acid up. Even if you don't go strictly low carb, cutting out sugar and refined flour is a powerful way to reduce your symptoms rapidly. And finally, the number 1 most impactful way to stop acid reflux naturally is to lose excess weight. Excess body fat puts physical pressure on the stomach and is one of the strongest risk factors for GERD. Research consistently shows that losing just 5 to 10% of your body weight can reduce reflux episodes by 40 to 60%, and in many cases completely resolve the condition. It's the gold standard for long-term relief. To recap, while quick fixes like gum and alginase help, the biggest long-term wins come from weight management, meal timing, and sleep positioning. Remember, managing acid reflux is often about combining these strategies rather than just relying on one. Consistency is key. These methods support your health, but they do not replace professional care, especially if your symptoms are severe. If you found these rankings helpful, please hit the like button and subscribe to an eye for more evidence-based health videos. Do you have any natural remedy that worked for you? Let us know in the comments below. Thanks for watching and see you in the next video.